my understanding is that it's up now. So I'm going to ask Alderman Austin if you could renew your motion.
So moved, Madam Chair.
Okay, the motion was to accept the substitute ordinance by the same roll call vote as was applied to determine quorum. We were beginning with Budget Director Susie Park. So I turn the floor over to you, Director Park.
Thank you, Chairman. And good afternoon, Chairman Dowell, Vice Chairman Silverstein, and members of the Committee on the Budget and Government Operations. Thank you for allowing me the opportunity to present today the amended 925 ordinance, which includes 7 grants for your approval. 5 of the 7 grants are for funds for the city's ongoing COVID-19 response efforts and include funding that was received by the city from the Coronavirus Response and Relief Supplemental Appropriations Act that was passed in December of 2020. The remaining 2 grants are for the Smart Grid Energy Efficiency Education Program, as well as a Red Line Extension Study, respectively. Before we get into the details around each of these grant programs, I wanted to also take a moment to address some of the incorrect information that has been spreading about how the city has spent the federal funds to address the COVID-19 pandemic. First off, we did not use any CARES funding for our civil unrest overtime for police or fire, and I want that to be clear. Secondly, as you may know, the city received over $1.2 billion of federal funding from the CARES Act, which provided a vital resource to address the impacts of the historic COVID-19 pandemic. These federal funds were comprised of approximately 20 grants that allowed the city to implement a wide range of response and recovery measures that supported our local businesses, protected our first responders and frontline workers, and safeguarded our most vulnerable residents. However, over the last 48 hours, the city's pandemic response and recovery efforts have been narrowly focused on one specific grant in one specific department, when in fact, as you are all aware, our comprehensive response has been so much bigger than that. While assumptions have been made, the reality is that the COVID-19 emergency required the city to pull every lever and leverage every available resource we had to ensure we were providing a robust response to the pandemic, while also making sure that our city continued to operate. And while Chicagoans were dealing with the health and economic fallout caused by COVID-19, our city was also balancing the financial impact from the virus, which created an unprecedented $800 million shortfall mid-year in 2020, with no federal relief for revenue replacement available to our city. It is critically important for members of the City Council and the public to view the city's response efforts holistically, since our response efforts and investments came from many funding sources. With the $1.2 billion in CARES Act grants the city received, our team set out to leverage these funds along with our existing resources to maximize every dollar for the greatest impact. These efforts resulted in the following. Nearly $300 million went to the Department of Public Health directly for the COVID-19 response. If we combine this with the grants that are on today's agenda, the Department of Health has received close to $439 million in federal assistance. Additionally, these and other grant funds also support the majority of our CDPH personnel. As a result, the $18 million that was reported as reimbursed by the Coronavirus Relief Fund covered the entire eligible corporate funded portion of their budget from March 1st through December 31st of 2020, because all other aspects of the CDPH personnel was already covered with other grant funding. Nearly $115 million for homeless services and housing assistance has been dedicated. If the $80 million in the emergency rental assistance program that is also on today's agenda is included, the Department of Housing and the Department of Family and Support Services collectively will have received $195 million to date in direct funding. This is not including existing grant funds that also support their day-to-day operation. Similarly to CDPH, the amount that was reported for DFS staff was also the only portion that was funded that was not funded by another funding source. Over $100 million have gone for assistance to our small businesses. This represents multiple rounds of assistance, including the Small Business Resiliency Loan Fund, the Micro Business Recovery Grant, the Together Now Fund, the Hospitality Grant, and the Performance Venue Grant, and has made this program the largest municipal assistance program for small businesses in the country. $376 million in grant assistance were awarded for O'Hare and Midway airports, which provided financial relief to 44 concessionaires and 60 airlines impacted by the steep decline in airline travel. $77 million have also been dedicated for various programs, which include food assistance, senior assistance, workforce development, violence prevention, mental health, child care assistance, broadband, and others. Leveraging all of these resources together, the city provided the following, to name the few: assistance for over 6,107 small businesses, rental assistance for more than 9,000 renters. We connected approximately 58,000 students with free internet access and deployed more than 15,000 hotspots to date. We supported 98 delegate agencies, which provided services for more than 8,000 children. We have served more than 6,500 returning citizens, ESL, housing insecure, and other vulnerable residents with workforce support. We have provided 1.5 million meals to our seniors, as well as 2.3 million meals for those in need of food assistance. And we also responded to an additional 3,500 calls for domestic violence assistance. Lastly, the city has leveraged both the FEMA Public Assistance Grant as well as a portion of the Coronavirus Relief Fund for all of the COVID-19 direct emergency response efforts, including all of the city personnel that has been committed and are redirected for this emergency. While guidance is very clear that CRF funds cannot be used to fill shortfalls in our revenue, it does allow the city to offset costs that were incurred on the city's budget that were substantially redirected to the COVID-19 response efforts. As a result, the city was able to transfer close to $340 million to the Coronavirus Relief Fund, thereby allowing the city to preserve important services and community programs in other areas while saving all of our taxpayers from bearing a portion of this shortfall. Had the city not sought these eligible federal reimbursements, the increased shortfall would have had to be addressed through additional borrowing or another property tax increase. To close, the city has had to balance direct relief to our residents with the very real impact to the city's operations and finances. We believe we were able to reflect our values in addressing the needs of our residents across the city while also keeping the city fiscally stable throughout an extremely unpredictable worldwide emergency. Moving into the grant programs that we have before you today. The first one is a request from the Office of Budget and Management for carryover grant funds in the amount of $68 million by the United States Department of the Treasury for the Coronavirus Relief Fund. Next, the city, through the Office of Budget and Management, has been awarded federal COVID-19 grant funds in the amount of $50 million by the Federal Emergency Management Agency for the Public Assistance Grant. We are also requesting for the Department of Housing they have received additional federal COVID-19 grant funds in the amount of $79,856,000 by the U.S. Treasury for the Emergency Rental Assistance Program, which grant funds may be subject to recapture by the Treasury if 65% of it is not used by September 30th. Along with this request to appropriate the grant funds, we are asking authorization to issue a solicitation on an expedited basis and to award a contract on such terms and conditions as determined to be reasonable by the Department of Housing for call center staffing, case management, and other services relating to the processing of the Emergency Rental Assistance Program applications for an amount not to exceed $6 million for a one-year term, renewable for an optional maximum additional one-year term if the grant is extended. The city is also, through our Department of Public Health, has been awarded additional federal COVID-19 carryover grant funds and new grant funds in the amount of $155 million and $61,000 by the United States Department of Health and Human Services for the Building Epidemiology and Health IT Capacity Program. And also, CDPH has been awarded additional federal COVID-19 grant funds in the amount of $24,343,000 by the Department of Health and Human Services for the Vaccine Preventable Diseases Program. We also have two additional grants that are not COVID related. One is through the Office of the Mayor, which has received private grant funds in the amount of $113,000 by the Illinois Science and Energy Innovation Foundation, which shall be used for the Smart Grid Energy Efficiency and Consumer Education Program. And lastly, for our Department of Planning and Development, they have been awarded federal pass-through grant funds in the amount of $110,000 by the Chicago Transit Authority for the Red Line Extension Study. Thank you, and I will turn it back to Chairman Dell.
Thank you, Director Park. Thank you, Director Park. I want to acknowledge that we've been joined also by Alderman Cardenas, Alderman Thompson, Alderman Scott, and Alderman Villegas, and you will be counted as part of the quorum. We'll go to questions.
Thank you, Madam Chair.
You're welcome. We'll go to questions. All right, the first hand I see up is Alderman Rodriguez. Alderman.
Thank you, Madam Chair. Thank you, Susie, for the presentation. I have a couple lines of questions. The first is around the rental assistance program, and I'm not sure if you're able to answer this or someone on the call will be able to have this dialogue with me regarding the rental assistance.
We have Commissioner Navarro is here with us to answer any other questions around that grant program.
Thank you. Commissioner Navarro, good to see you. I do have some questions that have come up from my constituents regarding leveraging these grants. You know, the amount of folks who receive these grants was only a small fraction of the need that was out there in our community throughout the whole Chicagoland area. So I'm happy to see this amount being allocated to the city and us getting it out. But, you know, as a sanctuary city, a city that we just refined our sanctuary policy, our welcoming city ordinance policy. I want to thank all my colleagues for their support in that endeavor. We know it's very important to make sure that our city remains very welcoming. And these types of grants disproportionately potentially would support individuals who may not have any access to state unemployment insurance or stimulus checks. So this type of rental assistance going towards all members of our community, including those who may lack documentation, is very important to me. So I'm quite curious whether that remains the case, that the undocumented will be eligible to leverage this specific grant.
Thank you, Alderman. We're very committed to, from the very beginning when we began with our own small grants, that we were very clear that these should be available to all without questions as to documentation status, and that they would not count as public charge. That has not changed with the federal, with the infusion, the following infusion of federal dollars. With this one, what I will say is we anticipate that will continue to be the case. We are getting, because this particular legislation was passed under the last administration, we have not yet gotten final rules and regs on it because the new administration is saying they want a chance to revise them. And so I don't anticipate that we would go in a different direction under this administration, but it's simply to note that we don't have the final rules yet as they continue to get their arms around what was passed just before they came in.
And is the funding source the same source? So federal government, same departments, just more money?
Correct. Yes, it's a larger dollar amount this time.
Okay. One of the other complaints that I heard, I don't know if sporadic is the right word, but definitely heard complaints just regarding the process to be able to apply for these grants. And I'm curious if your office has tweaked that process at all. What are the methods to apply? And if you've taken any measures to improve the process, potentially to make sure that folks have multiple ways in which they can apply, possibly not just via the internet.
Sure. And can I ask before I answer, are there any specific challenges that you could speak to?
Yeah, I think, a number of folks would prefer to maybe call a phone number and cycle through an application in that manner. Many folks would like to be able to do that in their native language.
Sure.
I'm not sure if the latter wasn't as an issue. Actually, yes, I did hear that as an issue. I'm not sure how deep that issue was. But I'm just curious about the space that we've provided for that.
Sure. Happy to answer that. So in both the first and the second round, and we plan to do the same in this round, we worked with community-based organizations and some citywide organizations for a portion of the grants. And we did that purposefully for the very reason that you say, that there are people who are less tech savvy, who are not just going to go online and fill this out on their own and navigate it by themselves, but may in fact need to be contacted by a trusted local organization to walk them through the process. And that's exactly why we did it that way. We did work with community-based organizations, with language facility, depending on different community groups. If in fact your feedback is that many folks in your community could have done with more of that, we're definitely open to hearing that. Our plan for this round is to again work with community-based organizations, and we're certainly open to and have already started looking at ourselves if there are additional groups to cover both geography but also groups of people that we may have not touched enough in the last rounds. So certainly open to specific suggestions on that.
Yeah, I think my office and yours should definitely collaborate on that. It'll be important to me. Thank you, Commissioner. One last line of question.
Alderman, sorry, we did circulate the list of CBOs that we worked with in the last round, just for folks' reference.
Sure, thank you.
And Alderman, I wanted to also clarify on the funding source question. While both the first round that Commissioner Navarro is talking about did come out of our coronavirus relief fund, which was supported by the U.S. Department of Treasury. This program is also coming out of the U.S. Department of Treasury, but it is a different grant program. So I did want to clarify that it's coming from the same federal agency, but they are two different programs.
Thank you.
Sure, thank you. And that's helpful given that, I think if it's coming from the same source, same location, I want us to be able to leverage it in the same way. But I think we need to be very mindful of that. Moving on, just some questions regarding the packet that was sent to us. I wasn't able to make the briefing, so maybe this was covered. But an extremely significant amount of money that was previously spent in the last year, particularly on the personnel line item, was spent on police personnel, CPD. My data indicates that 83.8% of the personnel line was spent on policing in March. I think it was March through May that is from, and that also represented 59.8% of the total coronavirus relief fund. I just having a very hard time understanding how the coronavirus relief fund went to fund essentially CPD personnel expenses. I would have thought it would have went to the Chicago Department of Public Health for direct supports there.
So thank you for that question. I think, what I was trying to convey in my opening is that the way we looked at the full pot. So, one of the things we have to kind of look at is the full 1.2 billion. For public health, they had a lot of other funding sources. And one of the things as we got all these different CARES Act funds is how do we leverage all the different buckets? Each grant had a clause that if some other grant was covering it, you couldn't. So for public health is a great example, where as I mentioned in my opening statement, they had close to $300 million of grant funds already. A lot of their existing staff were already on different grant programs that allowed for that staff time to go there. And what we covered and what you see on just the coronavirus relief fund was whatever was left of the corporate budget that wasn't covered elsewhere. So I think, part of, and I think maybe we could have done better on just the deck with the context is that, what went on the coronavirus relief fund are costs that maybe other places did not cover. So departments like health that has a big grant portfolio, Department of Family Support and Services that also has a big grant portfolio, a lot of their staff are covered elsewhere. So if there was a different funding source that allowed that activity there, then we left it there. And then the coronavirus relief fund kind of absorbed what wasn't available elsewhere. So health is a great example. That dollar amount only shows the corporate funded portion of that department. We took them the whole time. So everything that was just left that wasn't covered by a different grant, we covered on the coronavirus relief fund.
So if the deck was the problem, then we need a much better explanation than what's been given so far. I'm sure some of my colleagues will follow up on that line of questioning. I'm looking at my time. I'm timing myself. If we're doing 10 minutes, I think I have a minute and a half here. And I want one other line of questionings before I move on, if that's okay, Madam Chair. Just on this piece, I'm very interested in the percentage of dollars that will be going, the coronavirus dollars that will be going towards vaccination and Protect Chicago Plus communities. The percentage and an overall understanding of what actually is going into Protect Plus.
And I think we have, I can't see her, but is Tina Anderson on from Public Health? I think she can also talk to the vaccine.
Yes, I'm here. Thanks, Susie.
Point of information, Madam Chairman.
Yes, Alderman Burnett, point of information.
What is Protect Plus?
We will have Ms. Anderson explain that. Ms.
Okay.
Anderson, would you identify yourself for the record and then answer Alderman Burnett's question and then Alderman Rodriguez's question?
Thank you, Chair. Yes, my name is Tina Anderson. I'm the Deputy Commissioner of the COVID Response Bureau at Chicago Department of Public Health. And Alderman Burnett's question, Protect Chicago Plus is our vaccine outreach and community engagement program. We recognize that in Chicago, a lot of folks have a lot of questions about the vaccine, and we want to support programming that allows them to get those answers through trusted sources and community-based organizations. So we've already started deploying this program. We have a couple of community partners we've been working with very closely. But given the new round of funding that's before the committee today, we want to put some dollars behind that. And so to answer Alderman Rodriguez's question, there are a lot of different components of Protect Chicago, which is kind of the overall marketing, communications, community engagement program. The total amount that we have budgeted for that program right now is $41 million. Of that, we have 8.4 million right now that is dedicated towards Protect Chicago Plus, which very soon we will be putting out through competitive RFPs, competitive bid proposals, and some contracts with some partners to kind of release that money to community-based organizations. I'll put out there that we are gonna put these programs in place in such a way that if we receive additional funding from the federal government, we'll be able to have pieces of that included in this program as well. It's a really important program, we think, that will carry us through this kind of second half of the vaccination campaign, where folks who have a few more questions about what the vaccine is and if it's right for them, what it means for them, helping them get to that decision to take the vaccine is that program.
Thank you. Alderman Rodriguez, do you want to go to a round two?
Possibly. Let's see how things go.
All right, thank you. Alderman Tunney.
Thank you, Chairwoman. I just have a question. Through the chair, obviously we're not going to know the answer today, but Susie, I think you mentioned 100 million in small business relief, 6,000 businesses affected. I know that you've been giving us on a either zip code or ward level, but have you updated that and kept us abreast? And is the 100 million spent?
I believe so. I think the actual total was about 126 million. And I will get you, I will send through the chair for you, Chairman, the information.
I think the alderman would like to know update what's happening in their communities.
Yes,
So
absolutely.
it went from, I think your comment said 100 million, but now it's 126?
Well, I said over 100 million. The actual amount I believe is 126 to be exact.
Okay. All righty. That's all I have. Thank you, Chairwoman.
Thank you, Alderman Tunney. Alderman Mitts. Followed by
Thank you,
Alderman
Madam Chairman. Thank you, Madam Chairman. I'd like to know if you've mentioned several times regarding the community-based organization. that you're working with. Can you provide that information to us? And they're in several categories that you work with them on, whether it was rental assistance or the covert or violence prevention. Wherever you work with the organization, I like to be able to receive that information.
Okay.
Also, I want to know with the amount of dollars that are being spent in various categories, and I too may have missed the budget briefing that was given on this. When it came to the violence prevention, can you tell me what is that being used for? Can you break that out for me?
Alderman, for violence prevention, I believe we supplemented, what was already in the 2020 budget with another $10 million. I will have to talk to Norman, our violence prevention team, to get you the details around exactly the line items for that.
Okay.
So I'll send that through the chair along with the CBO question that you had.
Right. I have.
Alderman
Go
Mitz,
ahead.
I just
Yes.
want to tell you that you have in what was sent to you today or yesterday, a list of the community-based organizations that were used by the Department of Housing for the rental
Okay.
assistance program, including the award amounts.
Okay. It did not include the violence prevention or rental assistance programs, none of that, right?
No, it did not.
That's what I'm looking for, that
Okay.
information. Okay, I'm looking for that information. And also
Point of
in
information,
this
Madam
bucket
Chair.
of money that is being, and forgive me, Chairman, I probably have to. Yes.
Madam Chairman, a point of
Point of
information.
information from Alderman Austin.
Yes, ma'am. Could you send that also to my office as well? Because I was looking for the same things and I didn't see it. It's just piecemeal on parts of it. Can we get all of it on the breakdown if that's not a problem, Ms. Parks?
So just to be clear, because what we put through the chair was a specific question about a specific program, but what you, Alderman, are looking for is all CBOs that we have worked with for every program area.
That's right. Yes.
Okay.
Because some of the ones are new, some are old. So we need to be able to, gel those together. Because especially the ones in housing is what I'm looking for also. All right. Thank you, Madam Chairman.
You're welcome, Alderman Austin. That's in addition.
I'm sorry.
You on me, ma'am.
The
I don't
list
know
of
what you said.
businesses as well.
Yes, ma'am.
Yes,
Director
I have
Park.
that on my list.
Okay. Alderman Mitz.
Chairman Dowell, could I just make one correction? The information we shared on community-based organizations, those are for the rental assistance. And we do have dollar amounts by zip code of how much they gave out, et cetera.
See, I didn't always have rental. Now I got some rentals.
Okay.
All right.
Alderman Mitz.
Thank you, Madam Chairman. With a lot of information that Susan, Ms. Parks gave when she gave an opening statement with regards to funds of how money was allocated and given the time frame, there's a misconception of how money was spent for the police department. Is there any way we can get a clear statement as to how that money were? I hear what you're saying, but to make sure that we get it accurately to our constituents, that we get a short summary of that breakdown.
Yes, absolutely. I can send that through the chair. So just to be clear, Alderman, you're asking for a list of what activities they did around COVID-19 and to provide that in a short summary.
Correct.
Okay.
And if I had to give you a little work, you could give a summary of all of the funds that we are allocating, so that it's a lot of information for today. So if we're able to see a need, homelessness, that's another area you mentioned that was really important, and it was really quickly went through. But how do we best advocate those dollars and help the city to be able to advocate where we see a need at, and not just the dollars that are being utilized. So if I have a subject matter of these funds being used, then we can best help to distribute them.
Yes, so what I could do is we'll provide a summary by program area
Correct.
of funding. Now, the other, the added thing there is, they have different expiration dates, but I'm happy to share that summary so that everyone has, by program area, dollar amounts and a summary of that.
Thank you.
Okay.
Thank you, Madam Chairman.
Thank you, Alderman Mitz. Want to add Alderman Curtis to the quorum count. Thank you very much, Alderman Curtis. Alderman Harris.
Thank you, Madam Chairman. Now, on the 280 million that we spent on the Chicago Police Department, that's right, that's the total amount, direct parts?
Yes.
Okay. So that's all grant funded, right?
So that is every expense that we have moved from our corporate fund to this grant. Yes, correct.
Okay. And so we have guidelines, meaning that you just can't decide that you're going to move 280 million over there. So break down the 280 million and tell me where we spent this, because did we spend it in the districts? Did we spend it? Where did we spend the money?
So the $280 million is directly related to COVID. So they are, they make up salary cost for the police department for the activities that they did just around COVID-19. This includes conducting wellness checks. So we had the whole, CAP's office doing, all of our community policing officers doing community wellness checks. We were augmenting at the airports security. So right at the onset, when we were starting just with, very early March, late February probably, when people were coming into O'Hare, they were helping all the airports with screening. They also provided security for all of our testing sites. And they were also deployed as around-the-clock security at our alternate care facility. So as long as that was being built and up and probably back down, they were also there to provide security. They also assisted at our various isolation and quarantine facilities. They were definitely part of all of the team over at the Emergency Operations Center since the beginning of this response efforts, and providing inputs and part of that core team there. And they were also assisting during the emergency response with the stay-at-home order. So a lot of tips came in through directly to CPD as well as 311, and they were helping DCP with all of those and responding to those calls.
And so out of the 280 million, how many actually went to overtime?
Only 3.
Only 3 million.
Only 3 million, and it is only directly COVID-19 related overtime. So it could have been for the security, if someone had to be on overtime because of the security, but it was only COVID-19 related.
So if I wanted my summary, I want my summary to say that these are grant funded. The grant funds say I can be spent in this parameter. Yes. And I want my summary to say out of the 280 million, it went to wellness check, airport, testing sites, yes, and security for the isolation centers and McCormick Place, and that the 3 million in overtime, only 3 million in overtime was used so that I could put that out in my community and tell people how we spent the money. So thank you. You're awesome.
Thank you, Chairman.
Thank you, Alderman Harris. I would like to add on to your request. The wellness checks, for example, if you could say how many, that would be good to have as well. Alderman Cardenas, followed by Alderman Wagisback.
Thank you, Madam Chair. My question is relating to also the CPD expenses, because I mean, obviously, a lot of folks are somewhat not disgusted, but they're somehow upset that this amount of money went to CPD. But I mean, this is a health emergency, and so if you can explain this from a budget standpoint how that works. And second question is, during the riots or the unrest that happened, would that was part of COVID, was it not? I mean, you can make the case that was related to the fact that people were not in their stores, people were not manning those places, and it was an opportunity for people to kind of did what they did. Explain that. Is that not part of that?
So to answer your first question, Alderman, on kind of how we approach this, again, we went through, and I do want to clarify, because I think I've seen a lot of, discussion that we gave the police department this money. We did not give the police department this money for them to, decide how to spend it. Really what it was our entire workforce, across every single department. So, police is one of them, was redeployed and directed to COVID-19 response. And, definitely from March through May, June, it was all hands on deck. And so what we did is we went through every single department. We said, what was your role in this response? And what we did is, budgetarily, is we looked at on the corporate fund, how much of that was on the corporate fund, and all of the personnel expenses were absorbed by the corporate fund. And so because they were eligible under this grant program, we transferred that cost over to this grant. And so essentially reimbursed our corporate fund. Now, your question about the civil unrest, there are other cities that have tied this, their civil unrest costs to the pandemic. We have not done that. And so, the time that we are accounting for all of our police activities really at the front end, where it was really all hands on deck, which was, from the beginning of March through mid-May. So we have not attributed any civil unrest costs to COVID, but there are, different places that have made that connection.
Will the second round of funding in the new spending bill from Washington, will that be included? Would that be something that you're going to entertain?
So I think the second round, what we have been, outside of all of the COVID relief that we've been asking for, we are also advocating for direct state and local relief. And this is really to help with our shortfall. This is a way that we have leveraged an existing fund, within its eligible guidelines to help with our shortfall. But what we're asking, what we're advocating for is direct relief that will help with our gap. And I know all the hard work that went into, passing the 2021 budget. So, I think it's something, depending on whatever the parameters are that come out of, Congress, if it comes out, is something we can look at.
Thank you, Madam Chair. I think it's good to be educated on what really transpires, so that we don't get all worked up about something that perhaps doesn't happen to be true. So thank you.
Absolutely true, Alderman. Thank you for that last statement. And you will be sending this summary that Alderman Harris talked about and Alderman Mitz talked about to everyone.
Yes, Chairman.
All right. Alderman Wagisback, followed by Alderman Scott.
Thanks, Chairwoman. Well, thanks for that clarification, Director Park. I think it's important that we're able to get this information on paper, though, so we can, kind of see how the whole thing is breaking down. One of the questions I had was regarding pre-budget. I think this came up in September, October. Did we have a set aside of some of those funds that you were putting in reserve? And has that funding been used at all?
So we did have, as part of our coronavirus relief fund, back in June, we set aside about $40 million for a second surge. As we all know, we definitely had a second surge. But what we were fortunate enough to have also is that FEMA continued their public assistance program. So I think part of, what we did not know in June was when the president would decide to cut off FEMA public assistance funding, at which point, the coronavirus relief fund would be all that we had. So we did use a portion of that. I think it's roughly about 17 million, but some of the carryover that we are bringing across into 2021 is because we were able to leverage FEMA. So we didn't have to really, use everything fully.
And was any of that used for policing, or was that directly related to?
Oh, so the police costs are only for March 1st through mid-May.
Yeah.
So that's it, which we'll make sure to also clarify. But
so none of the reserves went to that either.
Correct.
Okay. And then I know you talked about this in the budget, but you'd also talked about it that summer and even into late summer. Have any of the reporting rules changed on how you must report to the federal government for the uses of these funds?
No. So, we're still reporting. Obviously with the new administration, we are awaiting to see if anything has changed. I think one of the things I can say is, with the coronavirus relief fund and a lot of the CARES Act, it came out quickly. And as we probably talked about in June, a lot of the rules hadn't come out with it. So we were kind of going, and figuring this out, and new rules would come up as we went. But in terms of reporting, what they have set aside, I know it improved slightly, but the process is still the same.
And then, so at the end of this, you said we have to spend it all 65% of it by September?
Oh, that specifically is the rental assistance program that's before committee today. That does have, the previous administration put a stipulation that we had to spend 65% of that by September 30th, or it was open to clawback.
Okay, but then
take it back and redistribute it back out to people that spent the money.
Okay, but then the other funds are till the end of the year.
The coronavirus relief fund, the extension we're asking for, yes, is till 12/31/2021 now.
Okay, so at the end of that, based on just, if you look back at the AARA back 2009, when we got federal assistance after the housing market crash, was there an auditing period for all of the funds that we spent? And I know you weren't sitting in the budget chair then, but will we expect to see the same type of auditing of all of our funding that is spent here?
So I can definitely say, specifically for the coronavirus relief fund, for that one grant program, we were told on the front end that at the end of it, the federal inspector general would be coming to audit everybody. So we are very aware of that. I would also like to add that we actually proactively engaged an auditor. So we have been working with an auditor since the beginning of all of this CARES Act funding and running those costs through the auditor to ensure that they are in compliance. So we actually took the extra step and the due diligence to bring on an auditor that we have been working with this whole time to run all these costs through.
So presumably you ran some of the policing funds through there as well. I know we're only talking about the $3 million in overtime, but for all the other things that my colleagues that spoke prior to me, from Alderman Mitz, Harris, everyone kind of brought this up, of the $280 million grant funds on wellness checks, the airports, and I know the airports were massive. Everybody remembers the pictures of people just flooding the airports. So all of that funding would have to be in compliance with both the reporting of the independent auditor as well as the federal IG.
Yes, absolutely.
At some point in the future.
We have run those costs, with our auditor, and we continue to work on that, every day, as we incur more funds, more costs.
So at the end of that reporting period, I think I'm sure Chairwoman Dowell already has this lined up, but I would like to see if we can either have the independent auditor come back or at least have access to the report as well as the federal IG report to see how all these funds, on everything from the housing to what CDPH spent in the grants, all the way through the $280 million that we saw spent on quarantine facilities. And look, I I know specifically that we talked about this in the budget. We specifically talked about using officers on McCormick Center to protect those sites from people who, at that time, there was no guarantee of safety at some of those locations when you're looking at all that equipment that couldn't be left out there without some type of guard around it. But I know that you had talked about this, utilizing some of those funds to make sure that there wasn't access on the bad end of things. So I do realize that needed to be used. Well, I think that as soon as we can get that other breakdown beyond what you've mentioned here in summary, it would be helpful. And then in the future, as soon as we see an audit on how those funds were spent, both the independent one and the federal one, I think it would be important to make sure we double check on everything that's been spent and how you've allocated it. It would be helpful at that point.
Thank you.
Thank you, Chairwoman. I'm set.
No problem. Thank you, Alderman. If you recall, we agreed that the budget director would be coming back to us at least quarterly during 2021 to give us updates on the budget. And we can certainly add the auditor report.
Yeah, it might actually fall into one of those quarterly
part of that in the quarterly meeting. Thank you.
Thank you for leading on that, Chairwoman. I know you were pushing for it, so thank you.
Alderman Scott, followed by Alderman Thompson.
Thank you, Madam Chair. First, Commissioner Navarro, I want to thank you for the information that you sent over that I asked for on the last call that we were on. Want to follow up with Protect Chicago Plus and the RFP. When exactly is that RFP coming out? I can't remember. I'm sorry.
Thank you for the question, Alderman Scott. So this is Tina Anderson from CDPH. And we are working on it right now as we speak. So we're aiming to get it out soon. I can't give an exact date because we're still reviewing with law and making some program decisions, but definitely by if it's mid-spring, it's too late. I'll say that.
Okay. Well, the one thing that I want to make sure is that you contact aldermen in the local areas in which you're trying to get that activity. I want to make sure that we're able to give community-based organizations that we know and we trust and that are in the community and can reach people where they are able to access these funds. I think it would be a slap in the face that we give that money to an organization that does not do groundwork or know the folks in those individual communities. And I just want to be as helpful as I can to make sure that we don't fall into I don't want to say trap, but we don't bring somebody in these communities who don't know these communities. I think that would be harmful to what it is that we're trying to do as it relates to Protect Chicago Plus. So when that gets out, if you can make sure that we get that and we can forward those to community-based organizations and award, that would be very helpful.
Absolutely. Thank you, Alderman.
Thank you. Susie, we talked a little bit about the business revitalization fund. I can't remember. It was a small amount. Can you give me that amount again? I can't remember what that was.
Yes, as part of the carryover, so the $68 million that we are carrying over for the coronavirus relief fund, we have broken that up into 3 buckets, which include $25 million approximately for continued COVID-19 response, because that one needs to continue. We're adding $20 million to our vaccination efforts. So, what FEMA doesn't cover, what health doesn't cover, we will also use CRF for that. And then we had about $12 million set aside right now for neighborhood recovery. And that, I think, we talked about at the briefing. It's not set, we don't have specific line items for that, but it is something that we want to work with, everyone here to, help revitalize as we're coming out of COVID and moving into, real robust recovery of, how can we help our communities? It could mean, assisting our neighborhoods with reopening, small business support, more small business support, et cetera. So the dollar amount there is about $12 million right now.
And do we see any other monies because I know everything's allocated and everything was brought down from the federal government with this next spending plan. Do we foresee any more? Because 12 is a lot to try to decipher amongst all the communities in 50 aldermen, 77 communities, 50 wards. So do we see any more of that? And then lastly, because you can answer this and I'll be done, Madam Chair. But I just want to make sure that once we figure out how that 12 million is going to be spent, I know you're going to come back before us and let us know. So that would be appreciated as well.
Yes, we will share that. And, I will say, we have it broken in these 3 buckets. But as we go, let's say we don't need all of the response, we can shift that into more business recovery. I think, again, part of this whole pandemic has been just what don't we know is coming up next. And so these are broad buckets. We want to make sure we're, giving the vaccination effort everything they need and the resources. But if let's say FEMA continues and we don't need as much in the ongoing response bucket, then we can definitely shift that into more business recovery. And in terms of future packages, I know there's a lot of discussion at Congress of, additional support. So, we can see if there's more additional, small business and that kind of recovery dollars coming down the pipeline.
All right, well, thank you, Susie, and look forward to that conversation later. Thank you, Madam Chair.
Thank you very much, Alderman Scott. Before we go to Alderman Ramirez-Rosa, I did have a question for Commissioner Navarro. Commissioner, the amount of money you're receiving for emergency rental assistance is, 3 or 4 times more than you received under the first coronavirus grant. Can you tell me how you are what you're going to do to ensure that this money can get out more efficiently? It's a lot more money, a lot more households, a lot more applications. How are you addressing that?
Sure. Thanks, Madam Chair. It is about 4 times the amount of money that we received in the last round. So which is great news, and it's also a logistical challenge for us. And so in part because, as you know, our partner that we worked with on the last 2 rounds, Family Independence Initiative, is not the partner we can work with on this next round. So we're actually having to kind of start over and set up the new infrastructure. The reason for that is that they are set up to give direct payment transfers to individuals. And this round of legislation involves landlords as well. And so they are not able to make that leap with us, nor do they necessarily have the capacity to do 4 times the volume. So what we've been working on is basically we've got to cover 3 needs that we used to cover through FII. One is the software and the digital platform. Another is the staffing to actually work with folks to check their verification, to walk them through any questions they have, that sort of thing, and then to actually transfer the dollars and make the payment. So what we're proposing to do for this round is to engage with a new software company to create the platform that we need. As you know, our hope is to come back to this body next month with that request. We were working through some economic disclosure questions with the law department that we could not resolve in time for this meeting. So we hope to come back on that next month. The other piece of this, though, is we have a big staffing need. We need a high-touch situation so that, just as Alderman Rodriguez brought up, we want the ability for people to have a body they can talk to walk them through it. And even if they can fill everything out fine and have no questions, we need a body who can say if the tenant applies, they go and verify with the landlord. If the landlord is the one that applies, they have to go double check with the tenant to make sure their requests match. And so that is just a high touch process. So for that, our plan is, our request today is to be able to do a rapid RFP to be able to work with a staffing company or a partnership of some sort that can quickly provide the staffing to do that. We think that is an up to around $6 million cost. It is an allowable cost under the grant. And the idea would be, it's very similar to the way that CDPH did their expedited RFP for contact tracing. And this way, we can say we want to apply the city's equity goals to this RFP. We expect to meet MWBE goals. We would like to see some partnerships on the ground that actually benefit Chicagoans with these jobs. We've already put out feelers to organizations like Hispanic Chamber of Commerce and Business Leadership Council to ensure we would get, if we get the approval, a broad range of applicants. So we would commit to then coming back to this committee to report on the results of the RFP and ultimately the results of the eventual work that comes out of it.
Okay, well, I wanted you to get on the record your commitment to come back to the committee on your selections.
Absolutely.
Okay. Alderman Ramirez Rosa, followed by Alderman Moore.
Thank you so much, Chairman Dowell. And thank you to all of our city officials that are here taking questions today. I have a couple questions for our budget director to help me wrap my mind around Ordinance 2021-414 before I feel comfortable voting this out of committee today. So in section 1, it references the 309 million. Is that the total from all the numbers listed in the whereas clauses? So does that 309 million include the 79 million in emergency rental assistance?
I'm sorry, let me pull up. Is this in the substitute ordinance you're talking? Oh yes, in section 1.
Mm-hmm.
So this amount is all not previously appropriated plus the $68 million in the carryover.
So does that 309 million reference in section 1 include?
Oh yes, the emergency rental assistance, yes.
So it includes that, okay. And then from the amount that's not specifically geared towards like a specific program, like we know the emergency rental assistance program funding is going to go towards the technology and the labor to manage the program and get those dollars out to landlords and tenants. From the other amounts that are listed in the whereas clauses, how much of that is discretionary, where essentially the administration is going to be able to kind of pick through and say, all right, you know, from this bucket of money, we want to reimburse these personnel costs that we've incurred that are in line with this umbrella of dollars?
I'll let health talk about their funds. I guess, you know, I want to define discretionary as in there are still rule guidelines governing all of these grant programs because they're federal. So we have the $50 million under that I'm asking to increase the ceiling for our FEMA grant. Part of that is because we have been notified by under the new Biden administration that we no longer have to match it, which means that, you know, we had about $32 million of match funds in CRF for our FEMA public assistance program, which we will now absorb on FEMA. To the extent that there are certain guidelines of what's allowable on FEMA, but, you know, I guess I'm not sure if that is kind of where you're headed with your question of, you know, if we needed hand sanitizer, yes, I'm going to, you know, I could put that on the FEMA public assistance grant program.
Yeah, I guess my question is because, you know, I totally appreciate and understand that, you know, these dollars, while reimbursable and in some ways discretionary, there's limits on how those dollars can be spent, right? And it has to be in alignment, and there's going to be people both at the federal level and the local level making sure that that aligns. Because of course we don't want to spend money thinking it's reimbursable and then end up on the hook as a city. So I totally understand and respect that. But I also know that, you know, once we have that understanding of what is a reimbursable expense, that we in this as a city get an opportunity to kind of figure out, all right, this is reimbursable, this is not reimbursable. We only have so many dollars that we can get reimbursed. So we have to make those choices. And one of my issues that I have and that some of my community residents have is that other cities have made other choices when it comes particularly to personnel costs, right? We've seen other cities that are a fraction the size of Chicago spend a lot more money on different types of support programs for residents in need during this crisis. Whereas in Chicago, we did see a lot of our reimbursable dollars spent on reimbursing the police for the personnel time that they had spent. So I understand that, you know, it wasn't all of our CARES Act money. I understand that these were reimbursable things that were in line with the guidelines the federal government had established. And I also know that these were decisions made out of your pay grade, right? You are the one minding the books, and I respect that. But you are here to represent the administration. And so that's what I'm just trying to get my head around. All of that is to say, what percentage of this 309 million could be spent to reimburse the police for overtime, assuming that that overtime was incurred in doing things that are allowable and reimbursable under this federal funding?
So, the public assistance grant does allow for, reimbursement for overtime. The restrictions are very strict, but I could say that, it is an allowable expense on the public assistance grant under FEMA. The coronavirus relief fund, where we have put some of the citywide overtime expenses, so that's $68 million in carryover, that could be put on there. So those two are probably the only two buckets of this program of the grants that you see listed here that would at least have that as an eligible cost.
Gotcha. And so was the 68 million and the 50 million?
Mm-hmm.
Okay, thank you. I really appreciate that. Well, again, I know that you are just the messenger here. And at the end of the day, we're empowering our chief executive to spend these dollars. But I just want the record to reflect that, while I understand that policing and having them go out there and do things that is reimbursable, that we can get reimbursed for these funds, I really don't think that it's a good use of our dollars. We have a bucket of money in our budget for police overtime for a reason. And I worry that, when we are in this crisis, that perhaps the fifth floor was thinking, oh, well, it's okay. Let's send out the police and have them stop people from jogging on the lakefront, because that did happen for some period of time. Let's just send them out there and have them stop people from jogging on the lakefront, because we can get that reimbursed later on. And I would just hope that what the fifth floor hears is that there are many Chicagoans, of which I represent many in the 35th Ward, who want this money to be spent on reimbursable things that are going to provide them with the support that they need, the small business support, the health support in this time. So, I kind of wish that the 80 million in emergency rental assistance wasn't tied into this same substitute ordinance. I would prefer to see that this substitute ordinance includes some language on kind of, directing the administration not to spend this money on basically saying, hey, let's send out the police to go do these things and not worry about the overtime, because we'll get reimbursed later on through this federal money. I wish that this ordinance had those things, but I think the ERAP is good. I think the Department of Housing has done amazing work. In those earliest days, they really were able to roll out a program. So, I guess it is what it is, but I appreciate, and I might have some additional questions for housing, but for the sake of time, I'll turn it over to my colleagues.
Thank you, Alderman Ramirez Rosa. Alderman Moore, followed by Alderman Irvin.
Thank you, Chairman. First of all, I want to thank Alderman Michelle Harris for the questions and the request that she made, because that was along the lines of what I was going to do, especially and to what you added to it, Alderman Chairman Dow. So I appreciate that. So that took care of most of my financial questions, but I do want to ask, and this may be a Dr. Arwadi question, but is there a correlation between what we are doing in terms of spending our dollars to help combat this virus and other dollars here in particular? Is there a correlation between that and the us keeping a very low rate in the city of Chicago?
Thank you, Alderman. Yes, I'm not Dr. Arwadi, but I can address that question a little bit. So there's a lot of factors going into the declining case rate and the declining positivity that we're seeing. There are a couple places where our spending is directly contributing to that. For example, the community-based testing sites. As you know, percent positivity is something that we watch really closely. And the more tests that we have, the more people who can get free access to testing and do get tested when they're having exposure or are sick, the lower that rate's going to be. So that spending has a direct correlation there. Also, obviously, the spending on vaccination has a direct correlation. And we do think that we are starting to see a little bit of the vaccination effect, specifically in congregate settings where a bunch of people live together. Throughout the pandemic have been a high risk for outbreaks. And many of those settings, long-term care facilities, the jail, homeless shelters, are now getting vaccinated, and then we're seeing many fewer of those outbreaks.
And in comparison to other cities, at least what I've been seeing, but correct me if I'm wrong, overall, we've been doing well. I know I've seen state deaths rate, and I know it's hard to say from city to city, just in sheer number on a percentage. And again, this could be another Dr. Arwadi question, but if there's a correct language, and I don't know if the word is competitive, in terms of us being one of the better cities in terms of our numbers and death and everything. Do anybody know that right offhand?
I can't speak comparatively there. I can say for Chicago over time, we are continuing to see daily deaths improve. I think we're at about 8 right now, and at our peak, it was much greater than that back in December. Unfortunately, the deaths for COVID do tend to lag cases. So you tend to see cases come down, and 4 to 6 weeks later, you see the deaths come down. And so because our cases have been declining for several weeks now, we do anticipate deaths to continue declining. But I unfortunately can't speak to kind of how well we did death rate compared to other cities. That is a Dr. Arwadi question.
Right, but I think in terms of the efforts that we've made here, I think from at least what I've been seeing, we've saved a lot of lives. I know some businesses were affected, but in comparison to, again, what I've seen in other states and cities that I've heard, and I don't know who can eventually put those together, because of the work we've done, how many businesses were saved and things like that, so I think there's at the end of the day, that's the benefit that we're looking for. Who lives did we save? And all of this at the end of the day, and getting back on the other side, who lives did we save? And the businesses and homes, that we've saved. And I think there's a story there. And I know we requested some of the financial stuff, which is important to me, but I think that's the story that has to be told. And I think it's there to tell.
Absolutely, Alderman. I completely agree. I'll say specifically within our response within Cook County Jail and our response within homeless shelter settings, which are some of the absolute highest risk settings. There was national recognition. There were a couple CDC papers published on our work there.
Okay.
And additionally, in long-term care facilities, there's just been an extremely concentrated effort, and you see the difference in the conversation we're having versus the conversation New York is having.
Right.
Part of that is due to kind of a difference in approach.
All right. Thank you so much. Thank you, Chairman.
Thank you, Alderman Moore. Alderman Irvin, followed by Alderman Laspada.
Thank you, Chairman. This is for Director Park. You spoke of the $280 million, but what you stated was that this amount was spent in just 2 months. Is that correct?
Yes, the 281 though consists of both straight time salary. It consists of benefit costs as well as the small amount of overtime that we talked about. So it's about 8 weeks.
So, would it be safe to say that the entirety of the police department was totally dedicated to COVID response for that 2-month period?
So we did not take the entirety of the department. We went essentially bureau by bureau and section by section. But there was a lot of work done by patrol, which is a big bulk of the police department, as you know. So those were, that's kind of what drove the cost.
Has anybody assessed the impact that this may have had on overall crime in the city during this particular point in time? If everyone was so focused on this, and either I'll stop there. I'll just leave it at that.
I could talk to the police department about that. I think, we have to overlay, especially during this early onset. This is essentially when the city also shut down. And so I guess I'm not sure, that's something we could definitely post to the superintendent and what that analysis is during that time.
Okay. And you said that this has all been essentially approved by your auditor. Who's auditing this component, and will there be a special audit related to the CARES Act funding?
So Baker and Tilly is our auditor that we've retained to help just oversee all of the CARES Act funding. Like I mentioned earlier, especially the coronavirus relief fund, we knew off the bat that at the end of it that the federal inspector general will be auditing this program. So I'm assuming all of CARES at some point will be audited, but especially all the ones that are grant funded, they will still go through our annual audit as well. So we have multiple rounds of audit that will happen on all of these funds.
Okay. And has there been, and I'm going to speak to just the auditing component, is there any MBE participation with the auditing component?
If they're an MBE firm, I will.
Participation, is there?
I have to check on that one.
Okay.
Let me look into
And
that.
also, I think this is something that we just need to check in overall. I mean, we've spent a ton of money here, and it seems like Black and brown folks got left out of the equation when we went to spend this money. And so I'm concerned that if we continue going down this road, this is while it is a crisis, I mean, we economically need to be participating because we sure as hell are dying. We should have a chance to participate economically in what is happening here with these particular sets of dollars. And I want from you all some level of breakdown as to how these dollars have been spent, the dollars that we spent for goods and services, what percentage of those dollars went to MBE firms, and what those amounts look like and what they were for.
And Alderman, just to be clear, you're asking for the entirety of the CARES Act portfolio?
Yes, ma'am.
Yes. Okay.
And the final question is around the, I think the $20 million for the vaccination. It is for vaccination, correct?
Which is part of our carryover, or which one? The 24 million?
The 24 million, that's correct.
Oh, yes, that's a direct grant to public health, yes.
Okay. And what is is my understanding, has someone been chosen for that already?
So I can speak to that. Thanks for the question, Alderman Irving. We just completed the RFP evaluation process this week. And so we'll be announcing very soon the results of that. And that was for that award was actually on the FEMA financing.
Okay, so I guess my question is, what we're hearing is that the MBE component of that is not existing because some people have been told that they are not an awardee. So if they've been told they're not an awardee, then who is the awardee?
Yeah, so we sent out award notices today, and so we'll be announcing very soon the winner of that award. I can also say that the evaluation panel decided to not award the full amount, and instead we're going to put out a second RFP opportunity to allow smaller entities to bid. We got a bunch of feedback, including from aldermen, that the scope of the project was too big to include some community-based providers. We heard that feedback and we decided to peel off some of that funding and put out a second opportunity for smaller providers in hopes of more community participation there.
So how much?
Excuse me, Alderman, can you be more specific on the numbers?
Yes. So the award for the RFP for the kind of large vaccination contract that was for the original RFP will be $15 million. And the second award will be at least, the second RFP will be for at least 5.
So does that mean that that Black communities will have to wait until the second round is done to get vaccinated?
Nope, absolutely not. So the vendor that we'll be making the award to now will be taking over this kind of city-run operations and expanding upon them. They'll be working in exactly the same communities that we have been to date, which are in our Protect Chicago communities, which are exclusively Black and Brown communities. What we'll do with the second RFP is we'll add in more capacity there. So that $15 million is over an entire year. And so we won't shortchange. We will deliver every single dose of vaccine, and equity is our strategy on vaccine. And so they will be in Black and Brown communities. What the second vendor will allow us to do is expand on that capacity as more vaccine comes in and provide an opportunity for more community based providers to play a part in that.
I'm glad to hear that you speak on equity, but we also want some equity with the money. $15 million to go that's going to be primarily directed in those 15 hardest hit communities, most of which, look like the majority of the members of the council, and not see any level of participation on that money just doesn't make sense to us. And we think you guys need to do a better job of making that a priority for funding in these things. Come back and say we're going to set aside $5 million for smaller groups while the big chunk of the money is already out the door just doesn't seem to be fair. And we need some dialogue and conversation over this, and maybe need to, and this is a question I'll pose to the members of the council, that maybe we need to see these contracts before we approve them, because equity always seems to be in the conversation, but when the checks get cut, it doesn't seem like equity is at the focus of anything that we've been talking about here. And that's why it's important for us to see this stuff. So this is challenging, but we need to see how these dollars are being spent, because there's people that live in my community that are dying, but when it's time to get paid, we're nowhere to be found.
Absolutely, Alderman. I hear your concerns, and we are happy to have that conversation. I'm also happy to provide information on who bid for this contract. And after it's announced who was awarded it, minority and women-owned business participation is extremely important to us as well. And every single RFP that we are issuing gives extra points in the evaluation for minority women-owned businesses to give a priority there and an ability to encourage subcontracting. We have contracts that have MBE, WBE targets in them that have been executed already, which we're happy to talk about. So absolutely happy to dive into that.
Excuse me. So Tina, without divulging who the winner of the $15 million contract is, are you saying that there is MBE, WBE participation in that selection, or there is not?
Yes, there is.
There is.
Yes.
At what level?
I can provide details on that after the announcement.
But you want us to vote on this today?
I apologize, Alderman. I didn't come prepared with those specific details for this budget, but we can absolutely provide that through the chair.
All right. Thank you, Madam Chair.
The other thing, Alderman Urban, if you recall, during the weekly meetings we had, you were on that COVID budget committee, right?
Yes, ma'am.
We did review the MBE spend, so we probably should just have it put in a form where it's concise.
Now, I would agree with that. I think it's important for us to understand what these dollars look like. Again, it's a lot of misery going on in our community, but I think it's a double whammy when we can't participate financially with what's going on, when we know we have capable, qualified individuals in the community that could execute the work that's being asked for.
Okay, thank you.
Thank you, Madam President. Chairman.
Alderman Laspada, followed by Alderman Burke.
Thank you, Chairman. Budget Director have a set of questions, and I'm really appreciative that we have the opportunity to both look back and look forward here. Number one, so if I go by the 2020 budget for the city, salaries and wages for Chicago Police Department was 1.2 billion, or about 101 million a month. Going by the 3 months that we were reimbursing police costs for CPD, that would average out to about $93 million per month. And so I'm just trying to figure out how these two numbers match up. Does that mean, as Alderman Irvin was referencing, that the majority, potentially the vast majority of our officers were being pulled off for COVID-related tasks, or we somehow were employing additional officers? What did that look like?
I do not have the monthly breakdown, and so we can kind of pull again, of that 281, I believe 150, and I'll get the number through the chair, but I believe 150 is just salary, and the remainder is actually benefits, and then 3 million is for overtime. So, like I mentioned earlier, it is not the whole department. There were certain bureaus that we did not include. We worked with the police department to say, which areas, which bureaus, which units were working on COVID-19. So, I think there was, given the list that I gave to Chairman Harris earlier, of the work that was completed, different units were working and redirected to do some of that. I think, a lot of the patrol work was within, what they did. So I think that's kind of where we need to break that down a little, but
Okay.
It was not the whole department.
That's all right. I mean, did you say, so you said 150 million in straight salary? Is
In
that
just straight
correct?
time. I believe it's around that.
And-
I'll get the exact number for you through the chair, but it's in that
And
ballpark.
no, I'm just trying to understand, because then you said 3 million in overtime. That would seem to say 126 million in benefits. Am I understanding that right?
Yes. I mean, they have a very large fringe benefit rate. So that is correct.
126. Okay. Wow. Okay. So you referenced police being used to guard our testing and quarantine sites. Is this because we anticipated that those would be public safety threats?
I will need to get back to you. I don't know the exact, the reason. I know that it was requested and they did provide the security there. So I think it is a little bit of, as they were building out those the isolation quarantine sites, the people that were running it felt that they needed a security, and so police was redirected to provide that.
Okay. Could you ask the superintendent to provide through the chair a list of the arrests or the number of arrests that took place at the sites that they were providing security for?
Okay, I can see if CPD has that.
Okay, thank you, Budget Director. Now, 3 questions related to what we're moving forward.
Mm-hmm.
So this is Ordinance 2021-414, right? I only ask this because on the agenda for this committee meeting and for the reconvened committee meeting, the only version of this ordinance that shows up online is the one that references the $80,000 allocation to the smart grid program. Is there a place where the full substitute ordinance is listed online that I'm missing?
We accepted the substitute ordinance in the committee today. It will be posted online. We just accepted it today.
Okay. All right. So it'll be posted online. Okay. Have a question for, well, maybe 2 quick questions related to Department of Housing. Commissioner Navarro, so I understand that the latest round of rental assistance is going through landlords rather than renters. What is the accountability that comes with that to make sure essentially that they're then holding renters essentially harmless? Are there ways that this comes with additional eviction protections for those renters? Sorry, did the commissioner have to leave?
Alderman, this is Daniel Hertz. If
Sorry.
the, oh,
Sorry, no, go ahead, Daniel. You're talking.
no problem. So to answer that question, yeah. So one of the important changes that has taken place in the new round of rental assistance is the requirement, as the commissioner mentioned before, that if the tenant is applying, that we be in touch to confirm the application with the landlord, and vice versa if the landlord applies, to confirm the application with the tenant. So and if both parties are confirmed, then the funds are required by statute to go to the landlord on behalf of the tenant. So the way it would work, and obviously we're still, we have the RFP hopefully coming out, and are still setting up the exact design, but essentially the way it would work is the funds would be deposited to the landlord, and both the landlord and the tenant would be notified of the deposit and the amount, so that the tenant would have, and it would specify for which months the funds were covering. And so the tenant would have a communication from the city saying, your landlord has been paid this amount of money for these months, and so your rent should be considered paid for that time period. I will just add one piece of detail, which is that if a tenant applies and a landlord does not respond to attempts to be contacted, there is a provision allowing after a certain amount of time for the funds to be deposited directly with the tenant, and then I believe they would need to show some sort of documentation that then they use those funds for rent. But that's the guidelines that we've been provided so far by Treasury.
Super helpful to understand, Daniel. If I actually may go backwards for a moment, because I know that DOH was really busting it in 2020 to get these COVID protections, these measures out. But I also, like, when I looked at the departmental breakdown for our ongoing COVID expenses, and I may have missed something, but it looked like $0 of DOH staffing was reimbursed through our last CRF funding. I'm trying to make that dive. Susie, did I miss something in terms of their eligibility, or why did we make the decision not to use those funds in that way?
I don't think it was a decision not to fund DOH. I think, we have conversations going on. If there were staff directed, for sure, those costs would be eligible to transfer. So I think that's a continuous conversation that I know staff at our both departments are trying to make sure that we have not missed anyone who is eligible. It is not that we are not covering, DOH staff time. And I know for a fact, with Commissioner Navarro, that her team was definitely dedicated to both during, the initial response and in the EOC, and working on a lot of the housing stuff, as well as, with the rental assistance program. So I think that's just something, as we close out the year, that we're just still closing out and tying those loose ends. But it is for sure not because we have not allowed it.
Okay. So final question. I know we've talked the $68 million that is carrying over from last year's coronavirus relief fund about these broad pots of ongoing direct COVID expenses, vaccination-related costs, and neighborhood recovery. And I know that I saw this in your PowerPoint presentation, but I don't see it in the PDF we received related to this ordinance or in the substitute ordinance itself. So I guess my question is, like, where is the accountability then for how these dollars then end up getting appropriated? What should we expect to see?
So we will keep it in these broad buckets as I have presented to council. And I think, as we talked about in an earlier question, those are the three broad buckets that we have designated. And like I told Alderman Scott, like, if we don't need everything for COVID-19 response, I think we are still paying for, let's say, temperature screeners and, other disinfectant and stuff like that. But if we see that, FEMA continues and, we don't need those, then we can move it into, business recovery. So I think, kind of the guardrails that we have are, the 3 buckets that we have broken out to is kind of where we're committing to keep, this carryover funding for.
And what should we expect the reporting to look like around how those dollars are being allocated?
I think we could line item out, and I think, one of the things we're continuing to improve and will improve in 2021 is our dashboard, and how we maybe show these buckets and, what goes into them. So, we can definitely report out on, of these 3 buckets, what have you used them for? I could tell you, kind of, what we talked about in the briefing around, let's say, vaccination efforts is, this is one of 4 different funding pots that is going to help the vaccination effort. What's going here is more of the staff time. Again, the people that are working in the pods themselves, but FEMA's covering all of the operational costs, CDPH's grants are covering, the Protect Chicago Plus, some of the marketing. So, I mean, we have broken these out in general buckets of what's going where.
Okay, I think I'll be following up. I know my colleagues are like, the goal is just to see some transparency and some clear reporting around where these dollars are going. And that's all I have to say on that. Thank you. Thank you, Chairman.
Thank you, Alderman Laspada. Alderman Burke, followed by Alderman Cicho Lopez. Alderman Burke. You're on mute. Alderman Burke, you're on mute.
Can you hear me now?
Yes.
Yes.
Oh, good. I apologize. Thank you, Madam Chairman. I have a couple of questions about this $281.5 million reimbursement, if you could call it that, to the police department. Madam Budget Director?
Yes. Oh, I'm sorry.
I read a story online while we were in this meeting this morning that seemed to indicate, and I know I should have believed a long time ago that what you read in the newspaper isn't always true, but this seemed to indicate that most of these costs that were incurred in March and May, and I'm quoting from the article, were later identified as eligible for federal relief funding for things such as police performing wellness checks on residents, airport security, and screening for COVID-19, security at McCormick Place, et cetera. And I believe your testimony this morning was similar to that.
Yes.
You can't just nod your head. You have to say yes or no.
Yes, those are some of the activities that we have talked about. Yes.
Now, has it not been the practice, or am I confused, that when the corporate fund expends money on behalf of police functions at the airport, the enterprise fund that's funded by costs attributed to landing fees, et cetera, reimburses the corporate fund for those charges? Is that correct?
Yes, we have directly on the fund itself, officers budgeted on the aviation funds, correct?
And so is there an attempt now to reimburse the corporate fund for these officers that purportedly during March, April, and part of May were deployed to the airport?
So I think there is conversation with aviation in general.
I've only got 10 minutes. So if the answer is yes or no, just say yes or no.
That the airports are reimbursing for those costs? Yes and no. I think so. There, as I was explaining, I think we've had a lot of conversation about, different roles that people have played as part of our response. and where the line is that aviation covers. Now, the people that were directly budgeted on the airport fund that participated in that activity, that is the airports will cover. I think this is over and above that, and so I think that's kind of where the conversation is being had.
And who do you have these conversations with?
The staff at the aviation.
The staff at aviation. Who are the staff at aviation?
With the commissioner, and with their director of finance.
So not the police department.
No, not with the police department.
And I think your testimony was earlier, Madam Budget Director, that most of these police personnel that you referred to, which created the need to reimburse the police department for $281 million, came from the patrol division.
Yes.
Is that correct?
Yes. The patrol division was included.
If one looks at the annual 2021 budget recommendations, which in very great degree comply with what the appropriation ordinance provided. Am I correct in assuming that?
The appropriation ordinance for 2021?
Correct.
Does provide, yes, CPD's budget.
Okay. And the budget seems to indicate that in the patrol division, we're spending about $862 million for 9,702 officers. Is that correct?
That is what is budgeted. I will assume if you're reading from the appropriations book that is correct.
Oh, very good. So now, if we assume that is correct, that's $862 million for the entire year for 9,702 police officers, is it realistic to assume that these costs incurred in part of March, part of April, and part of May represent 33% of the entire amount appropriated for the patrol division?
I would have to actually look at the numbers and do the math around that.
Okay, well,
because I did not break it out by division.
I apologize. I'm not very good at math. The good nuns who taught me at visitation in 6th grade, I think, when we learned percentages, probably slapped me on the wrist far too often because I wasn't a very good student. But tell me this, maybe you can make it simpler. How many officers were deployed from the patrol division to provide security at McCormick Place?
I do not have all of the staffing detail with me, so I will have to get that through the chair.
Well, would it be 10?
I honestly, Alderman, I don't want to misstate this number and give you an assumption without actually having the number.
Well, would it be 50?
I'm sorry, what?
Would it be 50? 50?
There was a lot of staff, or were you asking about the alternate care facility at McCormick Place, correct? There was, that was an around the clock.
Was it not that was one of the reasons that $281.5 million had to be allocated to the police department? Was it not your testimony?
My testimony was that we had $281 million of eligible costs, which include straight time, overtime, and fringe benefits for the police department. I think the questions you're asking about specifics about, who was at the alternate care facility, I do not have it.
Madam Budget Director, how many officers were taken out of the districts, and from what districts did they come to be deployed at McCormick Place?
I can get you that answer through the chair.
Was it 100?
Well, she doesn't have the information, Alderman Burke, but is committed to getting you that information.
Okay, So if we don't know about McCormick Place, tell me how many officers from the patrol division were committed to wellness checks, when those wellness checks took place, and in what districts they took place.
We've been asked about how many wellness checks were provided, which we committed to providing that through the chair. The community policing officers participated in these wellness checks, so we will get that information.
All right, now,
Not from the patrol division?
No, I believe it's a community policing team or the ones doing wellness checks.
Well, those are in patrol, are they not, Madam Chairman?
I think they're their own division.
Well, maybe I'm misreading the budget, but all right, tell me how many officers were deployed to the airport for security when travelers had to be screened?
Alderman, I will have to get you, if you're going to ask me how many for each one of these buckets, I do not have that information. So we will get that through the chair.
Well, can you understand why I would think the questioning from Alderman Urban might have indicated that there's some lack of credulity to think that fully 1/3 of the budget for the patrol division, $862,438,000, could be attributable to these activities in March, April, and May, just during a limited 3-month period, or limited assignments. I'm sure most of us drove by McCormick Place when the facility was being remodeled to accommodate patients. I think most of us have neighbors that might be in need of wellness checks, but I don't know if you ever monitor the radio zones. We'd be hard pressed to understand how wellness checks could account for hundreds of millions of dollars. Even if we assumed, according to your testimony, that $150 million of this $281.5 million were attributed to salary, and that would leave, of course, 128 or 129 million for benefits, according to your testimony. I just have a hard time with your numbers. And if indeed you are going to reimburse the corporate fund for these expenditures at the airport from the enterprise fund, which is a practice that has existed for decades, I would wonder why that amount that's being sent to the police department shouldn't be utilized in a way that some of the critics have suggested. And if we believe that the criticisms, according to what the mayor said, are just dumb, quote unquote, these numbers that you're testifying to today would make most observers highly suspicious. And I don't think just dumb, quote unquote, but that's what these members of the city council are supposed to be about, asking questions that may at times be provocative or subject to debate. But for you to suggest, as you are doing, Madam Budget Director, that fully 1/3 of the entire appropriation for the patrol division, $281 million, is attributable to perhaps 3 categories during a limited period of time, defies any reasonable explanation. I apologize if I've gone over my limit, but I think there are more questions than answers here. Thank you, Madam Chairman.
Thank you, Alderman Burke. Alderman Cicho Lopez, followed by Alderman Rodriguez Sanchez.
Thank you, Madam Chair. I actually I have a few questions, but I'm going to follow up a few points that Alderman Burke made because I think it's important. And I also concerned about some of the math. So that just to be clear, I just want to have a few questions for the record because we have talked about, and I think Alderman Burke made a point about this. Ms. Park, can we state that on record that none of these funding, the CARE Act funding, went towards regular operating budget matters? Can we state that on record?
What are you, when you refer to regular operating budget, what do you mean by that?
Operating expenses that outside of the COVID, purely COVID-19 related work.
So CRF states, so the federal regulations state that work has to be done around the COVID-19. This is for all CARES Act funding.
Yes, correct. But I'm just, my question again is that I think that there's a lot of, in the previous question, there's a lot of items that went down. We're gonna wait for the breakdown.
Mm-hmm.
But this is a very simple question that is for the record, right? Because there's like $280 million that went, and I think a lot of my colleagues have asked this in many instances. I still don't think that we have a satisfactory answer around wellness checks, for instance, something simple, right? Okay. And I think something that every single alderman should be able to see, and it should be very visible if it's COVID-19 related expenses. So again, I just want to be clear, right? Wellness checks and some of these items have to be COVID-19 related, and I'm still having concerns around this.
So everything we spend under the CARES Act, for the most part, requires it to be tied to COVID-19. Now, different funding sources have different rules around that and what that means. But if your question is, do all COVID-19, all of our CARES Act funding require a tie to COVID-19? Yes, they do.
So in terms, so I'm gonna ask it in a different way.
Okay.
At some point, we were saying, for instance, like back in June, right, that CPD, for instance, wouldn't receive these funds. Now, at what point did these decisions change? And then, for instance, wellness checkings became a reimbursable item for CPD, and we could not have done that with other agencies, for instance. At what point and how that decision was made?
So in terms of wellness checks, with your example, other departments could have done it. If DFSS did it, that would be eligible. If housing did it, that would be eligible. I'm not saying that no one else was able to do it. I'm saying that that is one of the activities that the police department undertook. But that is not to say that other people also did not do it and that those costs were also not eligible. I also want to be clear that, for CRF, every single department, if you were substantially responding or redirected, then those costs were eligible to be reimbursed back. So I guess to your question, Alderman, around, wellness checks and, if DFSS did them, their costs would be eligible too. One of the things that we have to be careful of around all of this funding is what is funding what. And so, we've spent a lot of time leveraging the multiple pots that everybody has. So for example, if we had DFS staff that is CDBG funded, they've also allowed that activity on that grant. So I think, part of the discussion and what I've seen is that people see different dollar amounts under under the Coronavirus Relief Fund, but that's not to say that the CDBG grant that the DFS staff were on also allowed for that expenditure there as well.
Right. Correct.
Same thing with health. I mean, we talked about this earlier, but health had a lot of different funding sources around COVID-19. A lot of their costs, I mean, probably everything that they've been doing under this response and for this pandemic is eligible for reimbursement on some federal funding source. I think part of what we are trying to do is figure out where best to put those and leverage that so we get the most bang for our buck. So if there was health staff, let's say on a different health grant and they allowed for that expenditure, then they stayed over there.
Well, we'll see that in the breakdown. So I'm gonna so we'll see that in the breakdown, but again, I think there's a lot of questions still unanswered. So let's move, because I think moving forward, I think we gotta make sure that, in my opinion, the priorities are based on, and I think we heard it from multiple of my colleagues around equity. We talk a lot of equity a lot of times in press conferences, but when it's here on the ground, we still have a lot of work to do. Let's talk about the vaccination then. And I know that, someone from the health department mentioned this. We have right now the Chicago Plus program is serving 15 communities. I know that right now, one of the issues that we have around vaccination surrounds the supply of vaccines, but we expect that to change. Now, and the federal government certainly does a much better job than the previous administration. We know that this can drastically change by July. However, our infrastructure around or in our communities is not nearly enough what we will need to do vaccination for over 1.6 million people or so. Right now, we're limited to 15 communities. What is it done in order? I mean, I heard a lot that there's a lot to be done and that we're gonna do a lot of work to get more of Black and brown communities to get vaccinated. But a lot of that groundwork needs to happen now for us to have the infrastructure to start vaccinating thousands of people per day. And I think that needs to happen now. What is the plan to, I know that with the Department of Public Health, we talked in detail around expanding this to at least 26 communities. I'll tell you what this is important. Right now, for instance, you may be able to, and I think there are some groups that are really pushing this to restrict vaccination in communities like Belmont-Cragen, so that we prioritize Belmont-Cragen. But that means that people in Hermosa, for instance, are not getting vaccinated because they're not in the Chicago Plus. We can make the same case from Archer Heights and then probably Brighton Park, let's say. Now, how are we going to get ready for us to get to these 26 communities overnight if we don't lay the ground right now to allocate some of the funding to make sure that we expand that to at least the 26? I'm not even talking about the rest of the 77 communities. So again, my concern is what can be done around that line.
All right, thank you, Alderman. Ms. Anderson, can you answer this question?
Absolutely. Thank you, Alderman, for your question. And I'll say we absolutely agree. The groundwork has to be laid right now. And that actually, the Protect Chicago Plus RFP that I talked about, it's not just for the 15 communities. It's going to be for all of the communities that are ranked kind of high on the COVID Community Vulnerability Index. Additionally, as we anticipate getting additional funding, we are in conversation about potentially opening that up to communities in the moderate risk as a second priority. I completely agree with your point that we don't have the infrastructure there right now. So there's two angles that we're looking at this, from building up the operational capacity, and that's where the RFP that I talked about awarding funds to have a provider come in and be able to do actual vaccination clinics in those areas. We're going to make that announcement very soon. We're going to make a second RFP, as I mentioned, for local providers from those same areas to cover those same communities. That's the actual vaccination operation. And then there's the community engagement, the education, answering people's questions. A lot of people have a lot of questions about the vaccine, and we encourage those questions actually. And so we're doing a ton of engagement work right now in the communities that you mentioned actually. Working with SWAP on the south side, on the southwest side, working with Enlace and Little Village, all kinds of different. These are just a couple of community-based organizations that we're working with, but that we're doing town halls. We're having special events for seniors. We are doing all kinds of engagement around this right now. So I agree with you. The groundwork has to be laid right now. As you talked about restricting to zip codes. So we are asking people what zip code they live in for some sites. I want to be very clear. The city of Chicago is not the only vaccine provider right now. There are 525 providers registered to provide vaccine in Chicago, and we are working on getting vaccine to all of them as our supplies allow. We have made it very clear to our providers that the high CCVI communities are the priority for vaccination. That's where COVID has rampaged our city. That's where people are sick and dying, and that's where we are prioritizing our vaccination. And that was part of our announcement this morning. You might have seen when we started the first week of the vaccination campaign, we had about 14% of those who were vaccinated were Black or Latinx. And last week it was 50%. So we expect that number to increase and continue in the communities that you're talking about.
Well, thank you. And thank you again, Chairman. I think that's all my time. Correct?
Thank you. Yes.
Thank you.
Alderman Rodriguez Sanchez, followed by Alderman Lopez.
Thank you, Chairwoman Dowell. Thank you to all of you who have been working so hard during this time and are here today to answer questions. I'm not going to repeat a lot of the things that I have heard from my colleagues, but I do want to talk a little bit about the reason why people are so outraged right now and why the messaging around spending all that money on police doesn't sit well with people. Can somebody give me a sense of what the definition of wellness check is that we were spending money on using police for wellness checks? What is a wellness check by definition when when police executes?
That is a good question. We can probably get you a definition from, the actual activity that the police department did. I do not want to assume something and misspeak around that.
Yeah, and we're not
Yes.
if your question has to do with the $281 million, Alderman Sanchez, I'm asking you to focus it on the substitute ordinance before the committee today. Do you have any questions related to that? We have discussed this other issue. Director Park has committed to getting some information to people who are asking questions about the number of wellness checks. I'm sure she can get you a definition. How many officers were assigned to the McCormick Place facility? We will get those answers. So I'm asking you to focus your comments and questions on the substitute ordinance, period.
Chairwoman, I understand what you are saying right now, but I also have constituents that are waiting to hear about this and that are asking me questions about this. I would like to have my time respected because I do have constituents that want to know this information, and other colleagues have also asked, and they have been allowed to ask. So I don't understand why I cannot ask this question.
Because you're asking repeat questions, and we're
I'm not actually.
On the other ordinance. We're focused on the ordinance. You're not a member of the committee. You have, if you have questions related to the substitute ordinance, please answer them.
I am
Please
asking a
Please
question.
ask those questions.
Okay, I don't have any questions right now then, Chairman. Thank you.
Thank you very much. Alderman Lopez.
Good afternoon, everyone. Good afternoon, Madam Chairman. Forgive me for my late arrival, dealing with snow. I'm not going to try and rehash anyone's questions, any issues, but I do have a question for you, Director Park, with regards to, I know there's been plenty of discussion about the reimbursements and CARES Act. Understand it. It's been mentioned before. I personally believe that this is a way to mask the untruthfulness of the budget that was presented to this council and passed by this council last year, not knowing the full extent of how much money we were short, and never have been told that we were short nearly $420 million, which the CARES Act sought to kind of backfill with $360 million. What I do want to ask, however, as it relates to reimbursements related to the CARES Act, is that the aldermen, as all of my colleagues I'm sure are aware, were allowed to as well seek reimbursement for COVID-related spending. I believe each alderman was capped at $15,000, correct?
Yes, that's what, yes.
So, and of the 50, less than 10, I believe, submitted reimbursement or applications for reimbursement, correct?
I do not have the total, but it is a small number.
Okay. The question that I have as it relates to our reimbursement is that there were literally hundreds of millions of dollars accessible to the city of Chicago across all departments for all funds, as you just said, all things related COVID. Any department could have accessed. Why then were aldermen seemingly capped at $15,000 each for potential reimbursements, while other departments, most notably a few that have gotten a lot of notoriety as of late, appear to have had no cap? What is the difference between our efforts to address COVID at the ward levels versus a department answering the same call? And why was there no caps put on them?
So let me start back with your first initial comment about the shortfall. So we have talked about the shortfall during budget. It is the 800 million that we had talked about as we were going into budget, where we thought 2020 would be, and we are continuing to monitor that as we close out the year. And our last bits of revenue are coming in, and what we are able to transfer will help close that shortfall. So I do want to make sure I address that. We have been talking about the 2020 shortfall throughout the entire budget process. In terms of the aldermanic expense, we wanted, and I heard many aldermen say, we have, costs that, we've incurred within our expense accounts and in our offices. We wanted to definitely, and 15,000 is where we started. To see what the need was. Even with our departments, it was outside of the personnel costs, if they needed something for the entire city, then, those are the costs that we worked with them on as they were requested. So I'm happy to work with you. What came up in the briefing last Thursday is that, we would, if the carryover is approved, we would like to continue that and to assist, because we know you had different communications and other things that aldermen have purchased on your expense account that we could support within those categories. I think the hardest part with working with the aldermanic offices is maybe the contractual requirements that these grant program, the federal grant programs require. So I think that's where we have some back and forth.
Well, and Director, I will say that yes, you are 100% correct when it came to trying to backwardsly apply federal regulation to what we were doing 6 months ago. That was very difficult. I'm not arguing that point. It was hard for all of us. But my question is, we had a cap set to what we could apply for. We had a cap of $15,000. per alderman who had anything expensible that fit the criteria. But it doesn't seem like there was a cap on any of these departments, unless I'm mistaken, because it sounds like what I've heard and what I've been following throughout the day is that, there's been a lot of things that have been generally lumped into this category called COVID that we're trying to get reimbursed for. I know from the aldermanic side, it was very specific. We had details on what could and couldn't apply for, things of that nature. I mean, so much so that it was down to the script of a mass text message. But yet, if all that detail was required for an aldermanic office or 50 aldermanic offices to ensure that we met the criteria, how is it you could find other departments where it seemingly ballooned out of control to the point where so many of my colleagues are now questioning why tens of millions of dollars just seem to easily flowed one way, when for others it seemed to have been, more stringent.
So the rules that the guidelines that we put in place for the aldermanic expense accounts are the same ones we followed. And so, we just did it maybe, let's say health was getting something citywide, then, we follow the same rule. It just may have been at a bigger purchase. So, I do want to make clear that we did not set up a different set of rules for the aldermen than the ones that we followed.
So Director Park, if I may ask then, so everything that was communicated to aldermen as to the rigidity of what was expensible and reimbursable, everything that was previously done and moving forward, all of that can be verified as correct for every expense that's been reimbursed for all these other departments with 100%?
I mean, there may have been different types of costs. I think we were trying to understand, what types of costs, from what I have heard, did each aldermanic office have. So they were mostly around requests for communications. And so that's kind of, where the guidelines were set for that. And those were very clear. And working with the law department, we had to make sure it wasn't political in nature. Sanitizer, reopening costs, all of those kind of things, were the same guidelines.
No, I get that part.
Okay.
And I appreciate your indulgence, Madam Chairman, but I'm just trying to make sure that
you're asking the same question a number of different ways. So ask it one more time and let's move on.
Well, the reason I'm asking, Madam Chairman, and for all of my budget committee peers, is that, a lot of what is being questioned, aldermen were given the breakdown. And I think that when we look at everything that we were allowed to expense ourselves, I don't remember, or I don't even know if the city council itself was told that aldermen that had still doors open and working in outreach could have their salaries reimbursed, or for the city's sake, or that their staff could have their salaries reimbursed. I don't remember those options being available to all of us. So as we're finding out that $140 million was used for benefits, I mean, if that was the citywide policy, it should have been applied citywide to all of us.
Okay.
And as we're looking forward to asking us to approve this substitute ordinance and amendment at the full city council next week for future year, I want to make sure that if we're communicating that to us, that this is a citywide standard, then that citywide standard needs to be fully applied and available to every department and everyone who works in this government. Thank you, Madam Chair.
Thank you very much, Alderman Lopez. Director Park, do you want to respond to that? Are you ready for the next?
So we, just the response is that, we have been asked to continue that program in 2021. I know, as we were trying to figure out, how to apply that in arrears for 2020. If there are, different thoughts around that and suggestions, I would like to hear them. So, we are redoing, we are continuing this in 2021. So, thank you, Alderman Lopez, for your suggestions. And if there are things that, you haven't heard, that you have questions about, I welcome your input.
Got it.
Thank you, Alderman. Alderman Michelle Smith.
Thank you very much, Madam Chair. And I just want to continue on this line of questioning for a moment to say that as the head of the Ethics Committee, I have a real problem trying to have as alderman some part of my salary or part of my city paid salary divide up their work between COVID related that I might not have for a member of a city department. You know, everything that we do is scrutinized as certainly a city service, which we all spend the vast majority of our time at. And during COVID, I certainly worked I've been working overtime, and I'm sure all my colleagues are. But I actually welcome the scrutiny of the city departments in saying that it is the modifications to our offices that are really at issue, or the provision of PPE or something like that that may have come out of our expense accounts that are reimbursable. So I welcome the conversation, but I think it's a very dangerous, very dangerous thing unless you really can back up every single ounce of your time and your time staffing. So I wouldn't have brought this up, but the conversation made me very concerned. You know, our expenses are scrutinized, and they should be scrutinized. That something that we may think is a great constituent services could be viewed as a political expense. And I think that's for everyone's protection. So I'm going to leave that alone for right now and just ask about the pending ordinance. But Director Parks, the amount of spending that is the subject of this ordinance, can just to set it in context for me, because I am not keeping a running tab like I'm sure Alderman Dowell is. How much total coronavirus or CARES Act related or government payback for things that we're spending on have we received so far? Or do we expect to receive in the next short period of time, barring Joe Biden's attempt to push through another aid bill?
Thank you for that question. I think, the response depends on the fund. So something like the Coronavirus Relief Fund, we received upfront. Something like the FEMA Public Assistance, is an actual reimbursement. And so we are, putting that request in and awaiting for that reimbursement. So that question, I guess, definitely depends on the grant fund and where we are with different reimbursement requests. So we can look into that.
Can you give me the ballpark of the CARES Act or the relief fund money and a ballpark of the amount that we're seeking under FEMA? Those are the two big buckets of funds, funds in.
Well, so in total, it's about $1.2 billion. Okay. A little bit over $1.2 billion that we have received in CARES Act funding. Now, a good portion of that is actually reimbursement based. So, we have to spend it first and then we submit vouchers for reimbursement. Other portions of that, though, have actually come in. So like the emergency rental assistance program that we're bringing to today, those funds have come in already. So we're going to appropriate that. And then, Commissioner Navarro is going to work to get that out. Similarly, the Coronavirus Relief Fund, we have come in. But FEMA Public Assistance, some of these other grant programs are strictly reimbursement based, where we have to pay for it and then submit the vouchers, and then the check gets cut. So
how does and in general, how much of these funds end up? And I'm going to set aside this issue of the policing fund. So put that aside just for a minute. How much of those funds are spent in areas that end up providing services for people in this city?
I would say a good majority of that. So, when we broke it out, or when I broke it out earlier, what we did is we took all of the grant funding, and I know this, I'm kind of rehashing June, but, we took all the money that came in and then we broke it down into different program areas. And so I think, part of what I was trying to convey in my opening is that you can't just look at one grant. Because multiple grant programs funded, let's say, homelessness. So, there is a kind of, we can provide that kind of a breakdown of the funding streams that went to each program. But what we tried to do is leverage everything we received to really help, with all of these different services, whether it was the small business assistance, whether it was homelessness, rental assistance, all of these things. And we kind of, we took different pieces of different pots to really, try to maximize that.
So a good $1 billion worth of funding is really directed towards helping people, institutions, like businesses.
I would say outside of, some of the direct response, and even that, I think we use some of that money to buy masks and distribute those. And, a lot of that activity also happened within some of this like direct response pot, but, a lot of this funding went to all of those different service areas. So, yes.
Well, thank you. I mean, obviously I'll just say that the coronavirus is an extraordinary event in history. And it certainly has required extraordinary spending. And we sincerely hope that this council continues to support the kind of spending that we need to help our economy and our economy back on track, our people to get healthy, everyone to get vaccinated. And that's going to be an extraordinary amount of money, and we need to get it from Washington. So with that, Madam Chair, I have no other questions. Thank you.
Thank you, Alderman Smith. Seeing that we're at the end of the questions for this substitute ordinance, which appropriates money for
about to be a problem right here.
Emergency. Alderman Sawyer, could you mute yourself? For emergency rental assistance and for our vaccination program within the city, and for the Chicago Transit Authority Red Line Extension Study. I would like to get a motion to recommend approval of item number 2 on the agenda.
So moved by Alderman Harris.
Thank you, Alderman Harris, who moved this agenda item by the roll call vote as was applied to determine quorum.
On the motion, Madam Chairman?
You're not a member of the committee, Alderman Burke.
Pardon? Oh, I apologize.
You're not a member of the committee. Thank you.
Okay, you're right.
Hearing no objection, so ordered. The due pass recommendation of the substitute ordinance will be reported out at the next city council meeting on Wednesday, February 24th. There being no further business before the committee, can I get a motion to adjourn?
Motion to adjourn, Alderman
So moved, Alderman Scott.
Moved by Alderman Spizzato, so moves. Hearing no objection, so ordered. The Committee on the Budget and Government Operations is adjourned, and I hope everyone has a relaxing weekend. Thank you.